Dementia is not a single disease, but a general term used to describe a decline in brain functions, which is severe enough to interfere with daily life. It affects memory, thinking, and social abilities. When we talk about dementia, we're talking about a set of symptoms that are caused by various diseases or conditions. The most common type of dementia is Alzheimer's disease, which accounts for about 60 to 80% of cases. Other types include vascular dementia, Lewy body dementia, and frontotemporal dementia, which we will explain in a minute. Dementia typically begins with subtle changes that can be easily missed. You might notice that someone starts to forget things more often or struggles to find the right words. Over time, these symptoms worsen, and the person may have difficulty performing everyday tasks, recognizing loved ones, or understanding the world around them. Dementia usually starts later in life, but it's not a normal part of aging. It is more common in people over the age of 65, but it can also affect younger individuals, known as early-onset dementia. In this video, we will dive deep into dementia, what causes it, its symptoms, how it's diagnosed, and how it's treated. Causes of dementia. The causes of dementia are varied and complex, but they all involve damage to brain cells. This damage interferes with the brain cells' ability to communicate with each other, affecting thinking, behavior, and feelings. Different types of dementia are associated with different types of brain cell damage in particular regions of the brain. Number 1. Alzheimer's disease. In Alzheimer's disease, abnormal proteins form plaques and tangles in the brain, leading to the death of brain cells. Number 2. Vascular dementia. Vascular dementia is the second most common type of dementia. It results from problems with the blood supply to the brain, often due to strokes or other conditions that damage blood vessels. When the brain doesn't get enough blood, it can't function properly, leading to cognitive decline. This type can develop suddenly after a major stroke, or it might arise more gradually from a series of smaller strokes. Number 3. Lewy body dementia. Lewy body dementia is caused by abnormal protein deposits called Lewy bodies, which build up in the brain. These deposits can affect thinking, movement, behavior, and mood. People with LBD often experience fluctuating levels of alertness and attention, visual hallucinations, and movement problems similar to Parkinson's disease. Number 4. Frontotemporal dementia. Frontotemporal dementia involves the progressive degeneration of the frontal and temporal lobes of the brain, which are areas responsible for behavior, personality, and language. FTD is relatively rare but tends to occur at a younger age than other types of dementia, often between the ages of 45 and 65. Number 5. Parkinson's disease dementia. Parkinson's disease dementia is a decline in thinking and reasoning that develops in some people with Parkinson's disease. While Parkinson's disease primarily affects movement, about 50 to 80% of people with Parkinson's may eventually experience dementia. The risk increases the longer a person lives with Parkinson's. Other medical conditions can contribute to dementia-like symptoms. These include severe infections, such as meningitis or encephalitis, brain tumors, multiple sclerosis, and long-term substance abuse. In some cases, treating the underlying condition can alleviate the symptoms of dementia. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Symptoms and how they feel like. Living with dementia can be incredibly challenging, both for the person experiencing it and their loved ones. Early symptoms often involve memory loss, particularly for recent events. Someone with early-stage dementia might ask the same questions repeatedly, forget appointments, or lose track of personal items like keys or glasses. They may struggle to find the right words during conversations or get lost in familiar places. As dementia progresses, these symptoms become more pronounced. Memory loss becomes more severe, and the person may forget the names of close family members or have difficulty recognizing them. Communication becomes increasingly difficult, and they may have trouble understanding what is being said to them or expressing their thoughts. Reasoning and judgment are also impaired, making it hard to make decisions or solve problems. In the later stages of dementia, physical symptoms often appear. The person might have trouble walking, swallowing, or controlling their bladder and bowels. They may become easily agitated, anxious, or depressed. Hallucinations and delusions are also common, particularly in Lewy body dementia. Living with dementia feels like a constant state of confusion and frustration. Imagine knowing that something is wrong but being unable to pinpoint exactly what it is. Everyday tasks that used to be simple become daunting challenges. There's a sense of losing control over your own mind, which can be terrifying and disheartening. For loved ones, it's heart-wrenching to watch someone they care about slip away bit by bit. Diagnosis of dementia. There's no single test for dementia, so doctors rely on a combination of assessments to make a diagnosis. The first step usually involves a detailed medical history. The doctor will ask about the person's symptoms, when they started, and how they've changed over time. They'll also inquire about family history and any other medical conditions that might be contributing to the symptoms. Next, a physical exam is conducted to rule out other conditions that could be causing the symptoms. Blood tests might be done to check for vitamin deficiencies, thyroid problems, or infections. Brain imaging tests like MRI or CT scans are often used to look for signs of strokes, tumors, or other issues that could affect brain function. A crucial part of the diagnostic process is a series of cognitive and neuropsychological tests. These tests evaluate memory, problem-solving skills, attention, language, and other cognitive functions. The results can help determine the type and severity of dementia. Sometimes, doctors might perform a lumbar puncture to analyze cerebrospinal fluid for signs of Alzheimer's disease or other conditions. Genetic testing may be recommended in certain cases, especially if there's a strong family history of dementia. Treatment of dementia. While there is currently no cure for dementia, there are treatments available that can help manage symptoms and improve quality of life. Treatment typically involves a combination of medication, lifestyle changes, and supportive therapies. Medications can help manage some of the cognitive symptoms of dementia. For example, cholinesterase inhibitors like donepezil, rivastigmine, and galantamine can help improve memory and thinking in people with Alzheimer's disease. Memantine is another medication that can help regulate brain chemicals and improve symptoms in moderate to severe Alzheimer's. In addition to cognitive symptoms, people with dementia often experience behavioral and psychological symptoms like depression, anxiety, agitation, and sleep problems. Medications like antidepressants, antipsychotics, and anxiolytics can help manage these symptoms, but they should be used with caution due to potential side effects. Non-drug therapies are also an essential part of dementia treatment. Cognitive stimulation therapy involves engaging activities designed to improve memory, problem-solving skills, and language ability. Occupational therapy can also help individuals develop strategies to maintain independence and perform daily activities. Lifestyle changes can also make a significant difference in managing dementia. A healthy diet, regular physical activity, and social engagement are all crucial for maintaining brain health. Creating a safe and supportive environment can help minimize confusion and reduce the risk of accidents. This might involve simplifying tasks, using labels and reminders, and ensuring the home is free of hazards. At the end, remember, dementia is more than just memory loss. It's a condition that affects every aspect of a person's life, and it requires a comprehensive approach to care and treatment. Now, we want to hear from you. Do you or someone you know have dementia? What symptoms did they have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.